IndiaTV, I'm Anshu J. Singh. You're watching HealthDNA, and with us today we have Dr. Brigadier Survinder Singh, HoD Pulmonology, Yatharth Hospital. Welcome, sir.
Thank you, and all the greetings to the viewers of IndiaTV on the day of World Lung Day on 25th September. Thank you.
So what are the common lung diseases?
Well, the commonest lung disease we have is like asthma. There are approximately 250 million cases of asthma patient, and there are approximately 50 lakh people die of asthma all around the world every year. Then we have COPD, that is bronchitis of emphysema, which is the third leading cause of death all around the world, and is a major cause of morbidity as we have in our country also. Then we have infections like tuberculosis, which is one of the leading cause of infection, the deaths because of infection in India. Approximately 1.5 million people die of tuberculosis every year. We have infections like pneumonia, which is very common in pediatric age groups and elderly age group patients, which is a very common infection. Thereafter, we have lung cancer, which is one of the leading cause of death because of cancer all over the world, and so far as India is concerned. These are common conditions we have.
So what are the early signs of these respiratory diseases?
You see, the commonest symptoms of respiratory diseases is like cough, which persists more than 2 weeks, or we have shortness of breath, which may be there. You have generalized weakness, exertion. Then you may have a sputum in the blood, blood in the sputum, or you have chronic cough with the sputum. These are common causes. There may be chest congestion, chest tightness. These are common causes of lung diseases.
So just like you were mentioning, why do so many Indians have respiratory problems?
One of the commonest condition is smoking. Smoking is very prevalent in our country, both in male and females, in urban as well as rural areas. Then we have a pollution, which is sometimes controllable, not controllable because of this parali burning, or is because of more vehicular pollution which is there. These are very common conditions which lead to lung infections. And then we have a lot of pandemics which are coming. Now, whichever pandemic or epidemic comes, mostly they involve the lungs because of infection coming through lungs. These are common causes.
So, sir, after COVID, how many cases do you see of lung infection? Do you see that there has been a lot of rise in these patients' respiratory problems?
Yes, certainly. The cases of lung disease have increased post-COVID for two reasons. One is patients who had effects of COVID, like fibrosis, which they're carrying on the chronic effects, plus a long COVID. One of the common symptoms which is there is a breathlessness. The patient may be otherwise okay, but extreme weakness and breathlessness is a very, very common symptom in cases of long COVID. Patient even recovering from COVID, not having X-ray findings, may still complain of breathlessness.
And also talking about the lung cancer, what are the warning signs?
Lung cancer is one, as I said, a very common cancer all around the world and in India. The warning signs of lung cancer is a cough, which is more than 2 weeks, then having blood in the cough or in the sputum, losing weight without trying to lose weight, decreased appetite, breathlessness, chest pain, chest tightness. These are all symptoms of lung cancer. How you diagnose is, unfortunately, by the time we diagnose lung cancer, it's an advanced stage. The diagnosis of lung cancer is generally done by the X-ray chest or by the CT scan. And unfortunately, by the time a CT scan or X-ray picks up lung cancer, it's an advanced stage, but still they can be picked early.
So what are the treatments available for lung cancer? What is the treatment?
Okay. Unfortunately, lung cancer is one of the very rapidly progressive cancer, but with nowadays a lot of targeted and therapies are available for the lung cancer, but unfortunately these targeted therapy are very costly right now. Though the international forums and the government is trying to bring down the cost, most of the time this treatment is not within the range of the common person, but they are available and things are progressing very well as far as lung cancer is concerned.
So what would be your message on Model of the Day?
The Lung World Day, the message of mine is very simple. It will be 3 aspects. One is a preventive aspect, that is people should stop smoking, avoid smoking. As far as the smoking cessation programs in India are concerned, they are not really picked up very well. We should be promoting this program so that more people can quit smoking, especially those who want to quit smoking. Then, as far as pollution is concerned, that government is trying their best, but we should put in our effort to use create less vehicular pollution, create less pollution on Diwali as is coming now, and other thing which we can do to prevent these things. And second is to use these vaccines which are available for prevention of various conditions like H1N1, be it COVID or pneumonia or influenza. These vaccines are available. They should be used and promoted more comfortably, and more the promotion will be more. Then comes very important thing is, as for treatment of lung conditions is concerned, is the use of inhalers. Unfortunately, in our country and all around the world, there are a lot of myths around the use of inhaler. Patients do not want to use much inhalers. So we should be promoting through a print media or the visual media the use and advantages of inhaler over the oral tablets and other things are there. These are the message I would like to convey to the public on this World Lung Day.
Thank you so much, sir, for giving us your time. Pleasure talking to you. Thank you.